My name's Hong Jin Kim, but I go by HJ. I'm the Ted B. Seagroves Jr. Distinguished Professor of Surgery. I am currently the Division Chief in the Division of Surgical Oncology and Endocrine Surgery. I'm also the Vice Chair of Strategy and Outreach for the Department of Surgery. I became a doctor for, I think, a variety of reasons. My dad was a surgeon in Korea and came to the U.S. as an anesthesiologist, and he met my mom when she was in nursing school and he was in medical school. Healthcare and health topics were always at the dinner table and was one of the things that we grew up with. Surgery has always been an interest, particularly because it's a field where you can identify a problem, you can offer a solution, and have somewhat of an immediate gratification in understanding that you've made the problem better for the patient. The other thing that I really liked about surgery was the way that surgeons approach problems. Surgeons really understand the idea of prioritizing the problems at hand and addressing the things from a very practical aspect, from the most important problem to problems that may be of lesser significance. There's lots of factors going into surgical oncology. I think not an inconsequential one is that my first week of medical school, my dad was diagnosed with cancer. And throughout, he's still alive today, but he's now had two separate cancers, significantly benefited by the care that he received from various surgeons throughout his medical experiences. My major interests from a clinical perspective are in hepatobiliary malignancy, hepatopancreatic and biliary malignancies, and my main clinical focus is in pancreas cancer. I also have a very significant interest in soft tissue sarcomas. Part of that arose from the fact that those are two diseases where the surgical care is really a very critical component of those patients that unfortunately get afflicted with these types of cancers. One of the things that I like about surgical oncology is that they're very much not focused on the operations itself, but really on the care of the cancer patients. And to really take good care of the cancer patients, you really have to be a good partner with the medical oncologist who deliver the chemotherapy, as well as the radiation oncologists who deliver the radiation therapy. In addition, you really have to be good partners with the basic scientists and the clinical trialists, whatever the discipline is, because to take good care of cancer patients, you have to be able to insert surgical care wherever it's appropriate, but really be actively involved in not only understanding the trials, participating in the trials, and being involved throughout the entire cancer process. Very fortunate to have one of the top comprehensive cancer centers in the country here at UNC. It's the Lineberger Comprehensive Cancer Center. The Lineberger Cancer Center really is the research arm. That's where all the basic science research happens. That's where the clinical trials mechanism is housed. UNC has an outstanding cancer program at a variety of different levels. The surgical oncology group here at UNC has been very good at being good stewards of those multidisciplinary oncology groups. So not only do you get an opinion from me, but you will also get a consensus opinion typically from UNC. We take very good care of cancer patients because we have a great collaboration between all the people that deliver cancer care at UNC. I've been doing this for quite a while, and people should know that the experience does matter in surgical oncology. I've had the benefit of great training throughout my career. I've had great mentors that have really instilled in me not only the technical aspects of surgery, but also understanding the different types of cancers that we treat. And last but not least, being a good person and really taking care of the patient, because I think that's absolutely critical. Oftentimes surgeons get into the habit of treating diseases rather than really taking care of the patient. At UNC and in our surgical oncology clinics is that we really do try to make sure that they feel like they understand that they're part of the cancer family at UNC and that we will see them through this whole process and not just through the surgical aspects.